My name's Jon Stabbe with Community Health Systems. My role is Director of Workforce Management. I would say our biggest challenge was that we did not have visibility into our entire program. So things like rates, the number of candidates that we had, the number of travelers, the reporting, all of those things were managed by an outside entity, and we did not have the ability to look and analyze those items ourselves. So we were not able to really see what the true rates in the market were. We didn't know how many candidates we had in the pipeline. We were relying on that other agency to tell us that information, and we weren't always sure we were getting accurate information. I would say every CFO should know that when you have the control and the visibility that Hallmark gives you, it gives you really great insight into what's going on into the contract staffing world, whether it be in rates, in supply, and demand. All of those kind of figures can help you forecast for what you need in the coming months or years, and you can plan ahead for those needs that you have. You can understand the rates that you're going to be paying and do the simple multiplication of how much you need to budget for upcoming fiscal years. It makes things a little easier because you have all of that insight. Gosh, they really like the whole platform. I would say it's kind of a one-stop shop. And what our organization decided to do was funnel all contract staff through Hallmark. We eliminated the need to have different contracts and different processes for obtaining different types of contract workforce. So instead of only going through the Hallmark system, we incorporated everything. Clinical, IT, HR, everything funnels through here so that we can collect the same data. We utilize that data then to have a one-stop shop for our contract spending. We're able to keep all of the credentialing in the system so that the system will monitor the licensure expiration, things like that, so that we can ensure that everyone who's on board in a contract staff position is able to work, and take care of patients or work in some other type of specialty. I would say is just your full access to the system. You can run your program however you need. You utilize the system how you see fit. You can build your processes within the system or around the system, and you can make the system work for your processes. I would say that's the biggest differentiator, because I think every hospital system has their own processes for contract staffing, and it gives you the ability to integrate with other systems. It gives you the ability to customize your workflow. All of those things really made it a big differentiator for us.